New moms, or even those that are not so new, can feel helpless, frustrated, and exhausted when your baby is crying and in pain. You know what I'm talking about. These overwhelming feelings can disrupt quality time and bonding with your baby, leaving you feel inadequate and frankly at a loss for how to soothe their discomfort. Oftentimes, the cause is gas, but many moms don't recognize the signs or know what to do about it. Well, Dr. Rebecca Winderman, a board-certified pediatric gastroenterologist, is here today with a solution. Welcome to the show.
Hi, thanks for having me.
Oh my gosh, this is bringing back memories. I have so much to share, and I know a lot of new moms are going to relate. But first, doctor, let's talk about just overall what causes gas. And how can we recognize the sign?
Great questions. I see it so many times in my clinic. So what happens is many times babies are swallowing air when they cry or through a bottle or even just normal gut development. Babies are learning how to process that food, break it down, and that causes gas. Gas is a normal phenomenon. We see it often with crying long after feeds are given. You see passing a lot of gas or burping, and many times, and more importantly, the telltale sign is some relief happens once they pass that gas.
So what should parents do when that's happening and they really don't know?
I would say the first and foremost thing that I would like to emphasize is not to go straight to something like reflux medications, changing formulas, or even worse, stopping breastfeeding, because many times all three of these things can disrupt the normal development of an infant's gut. I personally recommend taking more of an integrative approach. So I like to use things like tummy rubs or bicycle legs, and I also love Infants Mylicon Gas Relief, which is really why I'm here today to tell you about it.
My children's pediatrician, they recommended this 20-something years ago. It worked for me, big time. Tell me why you recommend this and why it's so fantastic.
I recommend Infants Mylicon Gas Relief to a lot of my patients as the first step. And the reason is because it's safe, it's effective, it's quick and easy to give. The active ingredient is simethicone, and it's a medicine that goes into your baby's tummy, breaks up the gas bubbles, and then exits the body as either a burp or a passing gas. And it never gets absorbed into the bloodstream. And that, I think, is the most important thing to consider here and why it's so safe.
And it's so easy to use.
You can use it straight from birth. You can give it after every feed up to 12 times a day. And it comes with this wonderful little syringe, and you just literally pull it up and it stops itself. It does not go any further up. And you can put it in 1 ounce of formula, 1 ounce of breast milk, or you can just give it as drops in the baby's mouth.
So it's perfect because it actually tells you when you have to stop, so you don't have anything to worry about.
Nothing to worry about.
As opposed to gripe water products that people use, why do you still choose this?
Simethicone, which is the medicine in Mylicon, has been FDA cleared as an active ingredient to treat gas. Gripe water has not. Mylicon, the amount you give is about 0.3 mLs or 6 drops, and I believe gripe water is somewhat, maybe 5 mLs or so. So easy to give, no dyes, no saccharin. You'll see a baby settling down, the crying kind of subsides, and you want to check with your pediatrician always.
Love it. Again, always consult with your pediatrician. Where can our viewers go for more information?
They can go to mylicon.com. It's also sold on Amazon and other retailers.
Fantastic. Thank you so much for your time.
Thanks for having me.
And now I know when my girls have children, grandma's going to know the answer. Mylicon. Yes. Thank you. And for our viewers, if you'd like more information, so easy, just go to our website, thebalancingact.com. We'll be right back.